The new year brought a new direction for the Ministry of Health and Human Services. Under their vision, Optimal Well-Being for All, they seek to help everyone achieve optimal physical, mental, and social well-being. Recently, the ministry launched their new logo and strategic direction.
Setting a strategic direction also requires you to do a clear analysis of what your organization is about. What are the core values that drives your organization? And as part of that exercise, we ended up with a new logo, a new brand for the ministry. And the key words that we use to describe the ministry is empowering. We want to be proactive. Again, we've gone through this whole exercise of redesigning our program so we can be proactive. We want to be innovative. We want to be in a position and where we can respond in a creative way to the needs of clients. The Ministry of Health and Human Services provides a vast range of services. Services that range from health-related but also human services. And I don't think it comes as a surprise to anyone that society is changing, and therefore our services must be able to respond to those changes. We embarked 2 years ago on setting up a strategic plan that would keep us focused and give us the direction that we need to be able to respond in a timely manner to the needs of clients. The clients that we saw 3 years ago are totally different from the clients that we're expected to see today. So the strategic plan allows us to have a broad framework in which to keep focused and to keep the direction centered around the needs of the clients. But we have redesigned our businesses. That means setting up new structures to more clearly articulate what it is that we do and what it is that we provide to the service. So the public now knows very clearly where they should go to access what kind of services. We've aligned programs clearly with the mandate of organizations under the Ministry of Health and Human Services.
One unit which has been realigned is Public Health Services. Currently, the unit falls under the Health Services Authority. Under the new plan, the ministry will create a public health department and appoint a director.
People, however, do not associate the Health Services Authority with health care in a preventive way. They go there when they're sick. Public health should be monitoring the health of the public, and it also should be promoting preventive care. And this we are going to do by putting public health under the ministry, and which would be the monitoring and evaluation body, and putting preventive care into the districts. So in all of our district centers, we will have primary health care and we will have programs that focus on preventive care.
Another newly formed department is the Community Development and Empowerment Agency. Although the agency is new, the departments it's made up of are not. The Women's Resource Center, the National Parenting Program, the Young Parenting Program, and the Community Development Unit all merged. The Department of Children and Family Services will also undergo a change.
We have the Department of Children and Family Services, a huge department that focuses on adult services and on children's services. We are dividing those into two clear, distinct units. So we are putting people who specialize in adult services over one area and children and child development over the other. So again, clearly defining our services so that we are structured in a way that we can respond in a timely manner.
The HSA, a Ministry of Health and Human Services agency, also shares the same vision.
What is wellness? Because it's important that people understand that to us it's not just about healthcare. It's not reacting to a disease process. It's your emotional well-being. Of course it's your physical well-being. It's your spiritual well-being. But if 2 out of 3 of those things are in order and you're unsettled even spiritually, then you're not going to feel well. And so tying all of those things together in holistic programs is where we're heading and is clearly the new direction of the Ministry of Health. We're still looking at adding some important patient safety equipment. For example, we have introduced a PAC system here, which is a digital radiology program, which allows the doctors to touch the radiology information wherever they are in the hospital. We haven't been able to afford adding that system over at Faith Hospital yet, but we're looking forward to the opportunity to be able to do that, perhaps through the capital funding by the government, perhaps through the new charitable trust that we're trying to set up, and perhaps by some donor coming forward and saying, hey, I can help there.
And the HSA obviously plays a very integral role in this, in that we look at implementing programs and services that will enhance the health and well-being of the people in the Cayman Islands. And this is all focusing on prevention. We're looking at ways that we can actually impact and reduce the chronic non-communicable disease by actually focusing on prevention and early detection of disease.
Addressing human needs holistically and empowering individuals to take control of their lives are the goals of the Ministry's new plan. That includes careful policy planning and consistency in their interactions with you. Ultimately, that ensures that both you and I can achieve optimal well-being.